Yes, welcome to Dimapur today. আমি kan week te ekbar medical topic li nai the kafni kan note. Itu nisna aji ami kan note ase Dr. Alem Phom, the MBBS MS obstetrics aru gynecologist. Ami kan layman kothatele maiki manula doctor, woman specialist kobo. Aibi aji ami kan tailote bishi relevant kothakan janibo. Every day ami kan maiki manuhanna life te কি ফেস কৰি তো অনলা কথান জানিব তাই আমি খানকে বুঝাই দিব আপনি কান লাস্ট অফ ফলো আপ করিবে ডক্টর থ্যাংক ইউ সো মাচ আপনি টাইম দেওয়ার কারণে
Thank you, Dimapur, today for having me.
Yes. And yes, doctor, Manu ekta first time maiki Manu type pregnant हुआ था इनके first time, ने ताई किमान बार डॉक्टर लोग दी विजिट को ले बांग अपनी सब
Okay. So, एक बार conceive हुई शे, pregnant हुई शे गुले तो minimum visit at least 4 बार visit करो लगे ना. First conceive हुआ लोगों दे एक बार visit करो लगे किले गुले इधर टाइम दे मुकान एक ता ultrasound करे. चानी बोले करने कि बच्चा तो कुत्ते locate करना से ना because बच्चा तो कौन बात तो womb से हो जाए maximum तो womb से locate हो जाए दे implant हो जाए ना होले भी कौन बात तो tube ते भी आ जाए तो उधर चोल्दी थोड़ी वो पिछे important है से ना. So first scanning like as pregnancy conceive करा लोगों दे first scan is very important especially to know कि चानी बोले करने कि बच्चा लगा उधर implant तो कुत्ते हुए शे बना ना. And another thing is that basic medicine like folic acid ना बच्चा लगा congenital anomaly तो किबा करो लेकर prevent करो लेकर ने ना इधर folic acid तो start करे दे मुकान first visit दे ना. And then another visit ने मुझे को अनिश्ना 4 visit तो minimum लगे ना. And then second one should be in the second trimester, and then 2 visits should be in the last trimester.
Okay.
Which 1 to 3 months is like first trimester, na, and then second trimester will be up to 28 weeks, na. Itu which the third trimester ina, na.
अच्छा किमान बार बुस्ती ते थाका खान ना एकदम रिमोट एरिया ते थाका खान जो ते हॉस्पिटल्स खान ठीक ठाक नहीं नोले आशा वर्कर्स खान भी नहीं ताखान करने भी अपनी किबा कोई दियो पड़ो लाइक ताखान डॉक्टर विजिट करो ना पड़ो लेकिन ताखान किबा निजोर के बचा करने और निजोर के सेफ्टी भाल था ठीक ठाक था कि बोले का
अच्छा even if doctor ke visit kuro na pare na but there will be like CHC PSC to thagibo to na yede chaina at least like folic acid start kori dibi na first trimester de folic acid to start kori dibi aro idu which second trimester ba onward iron or calcium to khabo lage na supplement iron calcium is very mandatory during the pregnancy na khalo bishi bharba khaile bi iron or calcium demand to increase hoi jay na idu garne idu tuita to khabo lage and tetanus injection lagabo lage tuita dose na like at least 4 weeks gap de tuita dose pregnancy de idu mandatory ase lagabo lage.
अच्छा किमान कोई अच्छा जितना प्रेगनेंसी टाइम ते बच्चा के कॉन्सीव करना से और फैमिली तो ले एकदम ना स्ट्रगलिंग फैमिली ऐसे ताकि के ठीक न्यूट्रिशंस कन आमागी खिलाओ ना पड़े निगा किबा किबी कन थके कोई ले भी थके तो होली भी बच आमागे एकदम नेसेसरी सबसे इम्पोर्टेंट डाइट लिखी ऐसी तो जाने ऊपर हो
yeah see just a normal rice dal na noile any pata vegetables na खाइसे कुली भी it is sufficient, okay. And then maybe you can take protein karne anda na not every day but like take a supplement of protein na so not necessary that like mangso kani khai thagibo lage na not necessary that one normal diet is enough but other than that iron calcium should be taken in the pregnancy to supplement na and this is available everywhere even in CHC PSC everywhere na so you can take that it's free of cost also. Now iron and calcium is a must in the pregnancy.
Iron and calcium totally must is okay. अच्छा the pregnancy दी आरो question करूँ मैं ना अच्छा बच्चा के इते ताई जिते पेट भीतर womb दिया से इते टाइम ती बच्चा के ताई किबा ताई बीमार आसे ना नोले ताईला abnormality किबा आसे निगाहान जानुले पारेन ना पारे
patient ताई निजो रा
patient बरा नोले before ताई birth na kura gete janam na diya gete
itu chani bole karne to ultrasound kuro like
to must dusra to iku chance nahi
see like in the pregnancy de ek bar bhi ultrasound kura nahi na bole bhi one ultrasound which is required is tifa ko level 2 scan ase anomaly scan na ekta bhi ultrasound nukuru le bhi the only mandatory ultrasound is like to tifa scan grow lage idu do 18 weeks to 20 weeks laga mature de idu tifa scan ekta hole bi kuri dise gule do idu do best ase ultrasound na alag time di kuro na parile bi
acha moi huduli try kora like kiba common signs noile kiba eniga thake symptoms mane ama tu bacha ki kiba hoisi bile ama law port jani jala bacha ki kiba hos niki itu question nu mukili gresule ekdam remote area ekdam dur jaga te thaki ase jote mane facilities khan nai takan garne
acha okay like ama ke jaundice na ulai ase na usually to ama ke body de itching hoye ase like ops cholestasis de usually to ama la pressure do na high ho jai se na or pregnancy related gestational diabetes koi ina ho jai shugule te amage chuli bhuk lagiwo noile weight to overgain kri ase na all those symptoms will come into play which will itu rado bacha ke effect ho jai na do pressure gestational hypertension koi na itu do pregnancy time de pressure to high ho jai amage de itu ho shugule do bacha do IUGR ho jai matlab बच्चा तांगुर होले ना पारे दे और प्रेगनेंसी रिलेटेड शुगर हो जाए शेकुले दो बच्चा तो एक्सेसिव वेट गेन हो जाए तो इदु डिलीवरी ग्रो ना पारे नॉर्मल ना तो इदु काम प्रॉब्लम जानी जाए
ओके अच्छा इते बच्चा जन्म हो जाए सिदे कितबा किमान बक कोई जेनेटिक ना ताई इनहेरिट कुरनाइ जिसि बीमार खान किबा किबि बच्चा तो इतु के प्रिवेंट कुरबुले प्रेगनेंसी टाइम दे is there any ways
there is this one prenatal testing and all ase na but which is not Nagaland do iman itu kan do corona pare de but in higher center and all they do genetic matching and all na kundu chromosome to phala ase itu select kurina na takan ke choose kuro pare which is not possible here in Nagaland but say like papa do ekta bimar ase na to itu heritage kuri dibo mon nai kole do bacha laga gene sequencing kuro janibo lage kuntu pala phala ase itu loina lowo kena na itu kan bi pare
na yeah but expensive ho
yeah it will be expensive
okay acha let's come down to our next topic na the pregnancy hui jaise na to ite delivery na the delivery time ti ite ache ki koi amigan jana tokti to duita ekta is a normal delivery ekta to is cesarean C section CS itu koi acha moi first itu question tekta apni ki hudi hunda tu ajigili kile doctors kan bisi bak CS ke recommend kuri aur kiman manu koi paisa kamawli karne tham CS bisi recommend kuri apni what is your response or no
usually what is that we as for me as a doctor as a gynecologist I tried every patient to go for normal delivery okay but there are some indication like which where normal delivery is not possible na if the bacha rado pette latrine kuri dise na bacha la heartbeat to thik nai na usually bacha laga matha to obstruct ho jaise na matlab fasi jaise na aro bleeding hoina start ho jaise maybe because of placenta previa na or placental abruption koi na idu kan hoi jaise kule to option na thake like we have to go for cesarean section but kumba ase like in our generation na like younger generation they are not able to take the pain to low na pare de so tahan nijur demand kure ki moke CSC kuri dibe itu bi ekta category ase puila nishna noina idia do bishibak to pain tolerate kuro na pare de itu garne bi cesarean section to rate to increase hoi jaye ase
mane itu apni kan ba kwala tun
nahi it's a patient's choice but itu cesarean section kura karne bi moila hisab te do like mokan chuldi thuri de na like ki hoye ase pitor de na latrine kuri dise na heartbeat khan to mokan monitor kuri thake na to ina na bacha laga life saving to increase ho jaise like poila nishna loina normally normal grow or last se bacha to thik na thake na itu la rate to comparatively low ho jaise because early detection ho jaise because of so much advanced technology and everything na so we joldi detect kuri de ki bacha ke idu hoye ase ina guna if we take up for cesarean and baby to ulai dise kule to bacha to palwa bachiwo pare na
acha but as a doctor apni kuntu e bisi suggest kuru nole কোনটো বেছি সেফ আছে ভাল আছে কো পারবো সিএস আর
normal delivery na of like that is for sure that normal delivery is best. Whichever is normal, that is always the best na further complication khan hoise kule bi normal delivery ta na thake na but cesarean section the later on complication there will be some few complication
bacha karne na
ama karne yeah
can you please
like ek bar cesarean section kuri dishe na first bacha the next baby also there's more likely chance of that like cesarean section ni kuro le ulai jo na or par operation kurise kule to it affects the health of the woman na and then complication like this one addition ho jai matlab ekchun ke laga lagi ho jai na to operation kura dem de bishi diktar ba ho jai kumba to iman addition ho jai iman ekchun ke like urinary bladder na aro wombs kan to ekchun ke addition ho jai shukule to operation kura dem de kita ba to udu urine bladder ke injure kuri de no noisle nari kan aina bi any lagi jai na wombs te idu operation jaga de to idu kan complication ulai jai
mane risk factor to CST
hoy
but still apni la sab apni ko to best is normal
delivery yeah
okay yes acha doctor ite amikan itala generation na itala time te amikan abortion ko word ile bishi common ho jise abortion ko to
yeah
na itu abortion to ile apni du ki ko what do you say about
abortion is never a good thing na according to MTB Act na medical termination of pregnancy act bi there are some indication ki abortion kurubole ulai jai na other than that these especially in Nagaland I feel like there are like so much teenagers coming for abortion na unwanted pregnancy do hoi jai ase na to idu do phal nai
acha ite unwanted pregnancy na itula awareness campaigns kan noile do's and don'ts kan to bishi ami kan dikhe thake there is NGOs tan bi kaam kore ase but you as a doctor na apni ek doctor ikna maikila doctor apni itu abortion na effect to itu jun maiki bro kore ase nole jun bro kore ase abortion itu affects health effects ki ase nole physical effects kan ki ase koi diu parbo ni
see especially for teenagers na like school ja noile college ja manung khan ek bar abortion hoi jai she kule to it affects our mental health so much even academic wise also it affect because we are under stress na that we did abortion na you have the sense of feeling of guilty na and the stress is there that is one thing that is mentally affected na and another thing is like in the future the pregnancy hona no hobo na idu bi kiba ase questionable ase because एक बार abortion करिसे कुले तो wombs लगा infection होले chances है ना and then इदु infection हो जाए कुले तो tube तो affect हो जाए तो future pregnancy होले chance तो कम दी हो जाए ना तो these are all the complication और abortion करा टाइम दे procedure करा टाइम दे भी ना कि वो कुले तो wombs के लगी वो पड़े instrument कैमरा लगी जाए bleeding होले chances है ना और wombs तो पितोड़े lining थका दो इदु दो एक्चुन के इनका pace हो जाए तो ना addition हो जाए तो साइने की कोई इदु ना इनका हो जाए कुले future de pregnancy होले chance कम दी है
মানে abortion বেশি kur থাকিছে বলে ফিউচার ডে লেটার ডেজ তাই প্রেগন্যান্সি হলে চান্স
কম দি আছে বেশি
কমতি থাকে ওকে আচ্ছা আর আলাক ফ্যাক্টর বি আছে কি পায় নেগা বাচ্চা তাই আর কনসিভ করু না পারালা beside abortion okay what infertility laga do na okay infertility is itself is a very huge topic okay but mota maiki sadi kurina na like 1 year relation de thagise without using any contraception after 1 years if they are not conceive kuro para nai kule to iduke infertile couple koi na to idu cause to ki ase kule do my like it's 30% to motala thage de aur 30% to maikila thage na aur 10% to common maiki ke bhi problem mota ke bhi problem de 25% to unexplained ase na so infertility cause to motala ki ase kule do sperm analysis kuro lage mokan na ki sperm count thik asina nai motility thik asina nai idu check kuro lage khali maiki karne hi infertility hua no matlab hoise inaga no hai both partner is equally responsible infertility hoise kule to tu tai chun ke bi sabo lage ki kote kom di ase bana na like female de ase kule to PCOD hobe na no isle to any endometriosis hoi jaise na idu kan bi infertility cause kore
na, or maybe there's a big fibroid which is not kiba ho jay conceive kurole ne de na, noile anatomical defect thage wombs te na, idu kan bishi hormonal effect bi thage idu, so we have to find out man chaniwo lage ki kile infertility hoye ase na. But after 1 year's conceive kura nai kule do, it's best that like you come and consult na, and then find it out what is the reason. Bishi deri no ha ke de, like maiki kan laga age is like very precious na. Once it grows a particular age na, mohan conceive kuro na pari jay na.
Particular age ko li kima,
like once we reach a 40 plus, it become very risky. Yeah, because anda laga capacity to kumdi hoi jay na. Anda to fixed amount hai ke do maiki an ke na, to every month ekta jai jay do, to when it anda to khotam hoi jay to mohan menopause hoi jay, matlab mens to na hoi jay na. So maiki an, the base is like before 35 na, reaching 35, before 35 if you conceive hoi jale to bishi phal ase, it prevent congenital anomaly bi prevent kore. Mohana age kiman increase hoi jay, congenital anomaly bachcha ke hobole bi increase hoi jay.
Acha itu infertility lage main cause ekta duita lo kuidu paru halo causes apni age ti mention to kuri si cause thaki na main common
as per India de saishe kule do mota laga to ase na, like mainly do like smoking and all those alcohol and all na, it affects sperm motility na. Motility effect kuri ja aro amount to decrease ho ja, mota ke bi moi kwanish na thage de, aro maiki kan ke ase kule do because of infection na, maiki kan la infection to white discharge jay ase, white jay ase guna mohan treat nukure de na, idu ra do idu infection to upor phale jay na, tube to effect kuri de, tube block kuri de, bujes na, tube ekbar block hoi jay she kule do conceive kuro na pare. This is one of the cause.
Okay, white discharge.
White discharge hoile mokan bishi lightly loina treatment no loi de na, idu ra do PID hoi jay, chronic pelvic disease hoi jay.
Okay.
Na idu ra do tube khan ke effect kuri de, main to tube effect hoi jale do like infertility hoi jay na.
So mane mota khan de doile food habits.
Not only food habits, they like these are one of the like which is like acquired mohan prevent kuro para laga ase de, alag do obstructive cause bhi dekhe na, like why sperm to ulawo na pare, kumba to ulawo na pare, kumba to like retrograde hoi jay, ejaculation hoi jay na, idu khan bhi ase mota la bhi, like you need a further evaluation why, what is the cause.
Acha mane to was
ase. Infertility itself is a very vast topic actually.
Okay, so we can parallel to next next topic.
Yeah, we'll talk in like very detail na about infertility. Yeah.
But enika mane within marriage la ek dui sal majute conceive no hoye enika koile to doctor ke consult kura bal.
Yeah, after 1 year of marriage na, like regularly thagi ase mota maiki na, like and then eko contraception bi use kura nai, kule bi conceive no hoye kule to better to consult it.
Better to consult the doctor.
The earlier the better it is.
Acha jigli to ki koi
IVF, yeah.
IVF.
IUI is also there, yeah.
Itu to lo kuidu parbo niki artificially ki koi.
Yeah. Yeah, infertile causes de idu IUI goi na.
IUI.
Yeah. Intrauterine insemination ase na.
Okay.
Idu and IVF is different, okay? And then IUI is usually done for mota laga problem thagile. Idu ki ase kule to mota laga sperm lo na, ina wash kure na, or idu which de we do a different method to select which is the best sperm, which is na the best sperm loina mogan maiki ke pitor de wombs laga pitor de tali de, with the help of some this one syringe or like that na, like we inseminate it inside. This is IUI. Usually for unexplained infertility na, ki infertile kile hoye ase na jande, idu kan ke aro mota laga sperm kon to kumdi ase, motility kumdi ase kule do idu taila sperm to pura loina mohan wash kurina select kure, best sperm select kurina maiki la bitore tale de, wombs laga bitore. Yeah.
Itu le chances kiman thake conceive hole.
See, the success rate of IUI and IVF is usually less, okay? Like it's 16 to 20% IUI in one, like ek bar ra.
Often hospital the facility as well.
Yeah. Even IUI and IVF facilities there, and we are doing here. Yeah, in Fed Hospital.
Fed Hospital.
Yeah.
Okay. So I think it will be an information. surrogacy something itu kiba ta thage na
yeah
itu bi kinega process kine thage
surrogacy na so surrogacy also can be done with IVF also na like mota laga asol mota laga na aro maiki laga anda loina fertilize kurina alak manunge dalibo lage na like there will be third person for surrogacy na so if they want only biologically lagi ase like mota maiki laga bacha lagi ase bole to mota laga sperm lo na maiki la anda do retrieve kro aro idu bijai IVF kurina like alak ama ke dali dibo lage na
gor garne mane sperm aro anda tu ek toile tu
fertilize kuri dibo na
asol bawa mana
hoy aro puka like carry grado amado alak khali like womb stay tai carry kurina delivery kurina couple ke di dibo lage na
itu bi pare
that is surrogacy yeah
itu practice hoy
itu bi practice itu bi pare yeah
apni kurishna ko ne
surrogacy I have not done yet
not done
no
maybe to rate success rate kinge success kiman success thaki tu
better than the like if the couple has a problem and the third person has no problem now the success rate is better yeah
today we'll have a detailed talk in our next
we can do that
next episode te bhalwa details te kotha go okay yes acha ajili bisi common na achanak ti manre tai tu womb cancer hui jise na to apni you're a specialist in this maiki la doctor can you know some common factors the woman maiki manan achanak ti the womb cancer ya cervical cancer itu is some common no preventions can develop janu paruni
yeah so cervical cancer idu wombs laga muk laga cancer ase de to udu do the like cause to ki ase kule to HPV virus na human papilloma virus idura cause kore maximum like most of the cause is because of this virus and idu virus to mukhan idu vaccine loise kule prevent kuro pare because of the vaccine na and it is the only cancer which can be idu vaccine pra prevent kuro pare na and idu cervical cancer wombs laga cancer do India te second most common ase na every year at least 1,70,000 nishna to detect kuri notun detect kuri ase every year and idu cancer ra murabi like 77,000 nishna every year muri ase manum na so because cervical cancer ino ase like initially mukan ekko na jane symptoms kam na thake bujes na white discharge all of aibo pare na noisle inakai thake noile alak any specific bimar na thake to kitiat mukan thurbo idu to last stage te thake idu garne mortality bishi high thake cervical cancer de na wombs laga muk laga cancer de na so that's why India like even it's all over the world to idu prevent kurbo lai garne mukan ke idu ke pachai na thaki bole garne pap smear kuribi koi screening kuribi koi na 21 years to 29 years te khali pap smear screening to 3 yearly kuribi koi 3 साल बिचदे kuribi koi especially sexually active thaga kan ke to screen kurbo lage 3 साल te ek bar do kurbo lage from 21 years to 29 years and after 30 years na we have to go like test kurbo lage pap smear plus HPV vaccine laga test HPV virus laga test kurbo lage co testing kurbo lage tuita bi HPV virus testing aru idu bijde pap smear tuita testing do 5 yearly kurbo lage up to 65 years
अच्छा HPV virus करने cervical cancer तो है womb cancer
हाँ
itu तो कि एक जन पर दूसरों के transmit करू करेंगे
HPV is a virus na any corona virus nishna na idu bi virus ekta ase de idu do mota ki bi lagiyo pare maiki ki bi lagiyo pare idu the sexually transmitted ase yeah
aji to sexually transmitted disease to HIV kla honi thakisina
and this is one of them and this causes cancer
HPV
yeah
to prevention asula
prevention is the best thing is vaccine aro vaccine bi mokan yade India de bi available ase even Dimapur de bi available ase na to idu do mokan from 9 years pra shuru kurina vaccine to lagao pare mota hoile bi maiki hoile bi tuida bi lagao pare
mota ki bi vaccine maribo pare mota ki bi itu lagi niki bimar
লাগিব idura do mota laga penis cancer hobole chance thake
itu HPV
HPV ba so idu garne idu prevent kurubole karne mokhan vaccine do lagai
vaccine
from 9 years to 14 years te khali duita dose lagavo na zero dose matlab itia lagai shi kuli zero dose and after 6 month ekta dose lagavo khali duita lagavo from 9 years to 14 years and from 14 years and above up to 45 years maiki gan lagavo pare idu to tinta dose lagavo pare zero dose matlab aji laga idu is 2 mahina bichide aro 6 mahina bichide lagavo pare
okay womb cancer na maiki manu tai bacha hoi ja pachi tibi maru pare vaccine to
best effective of vaccine to ki ase kule the sexually active no ha ke de ase it has like 98% protection ase de but mokan sexually active hoa which de vaccine lagai shi kule to efficacy to olop kum di ase hole bi mokan 45 years tak idu vaccine to lagavo pare
okay 45 years
up to 45 years up to aur mota kan karne to 26 years tak lagavo pare
26 law por
not effective it won't be effective much
so ita moi ki to effect no okay yes ami kan itu cervical itu womb cancer itu law por taru ami kan oncologist
yeah oncologist
takan lo tibi ekbar kotha go in next episode aru Dr. Alem lo te aru bisi related kotha bisi ase aru kotha nu dibuli karni bi apni kan if you have any queries apni kan kiba questions kan asu koile apni kan comment te likhi dibi ami kan next te atam de next episode te atam de tai ki tula aru tai lo dan dibu tu kotha tu and Dr. Alem tai ki apni kan Fire Hospital de lok pabo right
yeah
aru tai ki ina lok kun apni kan kotha bisi kotha kuru paru janu paru tai lo de yes doctor apni ke ami kan viewers kan especially for young girls maybe woman kan young woman tahan karne apni kiba tahan ko na para no libi mon de rakhi thake nega kiba kotha nega na opor apni kiba koi du paru bimar do's and don'ts kiba
yeah
important
so like for a girl menses na period menstrual cycle is very important na like make sure that you are maintaining a hygiene during menstrual cycle na and then when you have like a white discharge which is not normal which is foul smelling or like if it is a itching in the perineal area kan ase kule to come and consult to the doctor there is nothing to shy about it better to prevent it than getting cured. Okay. So like all those things there's nothing to shy about because we as a woman we understand their problem and then when they come and approach us we'll be like sisters like as sisters we can discuss the problem and we can treat you in a better way so there's nothing to shy about even if you got unwanted pregnancy better to come in the early period than coming in the later phase because the more the time baby grow inside it become more and more complicated even to get aborted also things become complicated so whatever problem you are facing like if either it's a menstrual irregularity white discharge or pregnancy related or anything better to approach it early because we as a doctor we care for the patient more than even you can imagine.
Yes okay yes ami kan comment de aru comment section de no description de Dr. Alem lage social media platforms te thai ki cholai tu de ami kan links an pathai dibo apni kan personally message pi kuru paru is that
yeah
then personally message kuru tai ke the ko na para la kothan ki ba su bile na I believe doctor tai bisi modot jo so thank you so much doctor
okay,
thank you yes thank you everyone and yes please do not forget to subscribe or yes comment de likhi dibi apni kan bi aru ki lage morom pa comment de to apni likhi dibi iti ko thank you so much everyone thank you